Hello everyone. My name is Angela Metcalf and I am here to talk to you about fighting lupus and rheumatoid arthritis. It is a hard disease to live with. People with these types of autoimmune diseases often need help as the disease progresses, such as needing help to pick up a simple pan. The background of rheumatoid arthritis, arthritis and diseases of the joints have been around since ancient times. In 1500 BC, Ebers Papyrus described a condition that is similar to rheumatoid arthritis. This is the first reference to the raw disease. There is evidence of rheumatoid arthritis in the Egyptian mummies. The terms of rheumatoid arthritis, Thomas Siddom first described a disabling form of chronic arthritis that was described later by Bouvet in 1880. A. B. Garrod, in 1858, named the disease rheumatoid arthritis. He then made the distinction between rheumatoid arthritis, osteoarthritis, and gout. Bannatyne, in 1896, found the appearance of rheumatoid arthritis that affected joints as it was first described. In 1940, Camro coined the term rheumatologist and Hollander the term rheumatology was coined in 1949. The treatment of rheumatoid arthritis. In the early treatments of rheumatoid arthritis, it included bloodletting and leeching. This is practiced in the Far East. It is the practices of acupuncture, acupressure, moxibustion, which is the use of heat, cupping, etc. were used to try to ease the pain. They saw that this did not improve the condition of the patients. The next use of treatment was the trial of heavy metals, such as gold, bismuth, arsenic, and copper salts. This showed some rates of success. Gold has been the best success over years. This is still a part of disease-modifying antirheumatic drugs, DMARDs. DMARDs are used in the treatment of rheumatoid arthritis. Pain relief of rheumatoid arthritis. The people of the early days found pain relief by using plant extracts of willow bark and leaves, which contained salicin. In 1929 LaRue identifies salicylic acid as the active substance that eased pain. In 1853, Gerhardt synthesized the acetyl salicylic acid that became aspirin. In 1949, was the beginning of phenylbutazone, that is a non-steroidal anti-inflammatory agent. Disease-modifying antirheumatic drugs, DMARDs. Methotrexate came into the play in the 1950s as a folate antagonist to treat leukemia. In the 1980s, methotrexate was found to treat rheumatoid arthritis. It is still known as part of the DMARDs. Anti-TNF antibodies. In 1975, monocyte-derived tumor necrosis, TNF, factor was first identified as the pathogenesis of rheumatoid arthritis. In 1993, anti-TNF antibodies was discovered to be an effective treatment to patients of rheumatoid arthritis. This slows down the progression of the disease. RA is a chronic disease that affects people of all ages, although it is shown as a disease for older people. There are children that get it as well, called juvenile RA. The progressive nature of this disease and the findings of how rheumatoid arthritis affected the tendon sheaths and sacs of synovium in the joints. He found how there was synovial inflammation or synovitis and cartilage damage associated with rheumatoid arthritis. This causes swelling of the joints, which can cause severe pain, stiffness of the joints, deformities of the joints, and possibly lose function of the joint. When the joints begin to swell and hurt, it is usually symmetrical, meaning both wrists may hurt or both ankles will hurt, etc. In 1941, there was a breakthrough at the Sinai Hospital in New York by Dr. Paul Klemperer for lupus as an autoimmune disorder. The researchers there first called it a collagen disease. In 1851, the term lupus erythematosus was first used by a French physician named Pierre Cazenave. In 1903, Dr. Osler identified lupus to be a systemic disease that could affect the entire body. A pathologist from the Mayo Clinic named Dr. Malcolm Hargraves, published a description of the lupus erythematosus or LSL in 1949. The development identified the systemic inflammatory part of the disease. This allowed doctors to diagnose at a greater reliability and to diagnose the disease faster. In the 1950s, the LSL is identified to be a part of the anti-nuclear antibody blood test reaction. I will get into the ANA testing later. Lupus is a chronic inflammatory disease that affects different parts of the body, including the joints, skin, blood, kidneys, central nervous system, muscles, skeleton, heart, and lungs. This is a condition where the body's immune system attacks its own cells and tissues. This causes pain, inflammation, and organ damage. Most people that have the disease have a mild and the symptoms are manageable. Unfortunately, some people can develop severe symptoms, which can be life-threatening. It can cause horrible skin problems. It can start out as a rash or on the hands. It turns into blisters that itch and begins to bleed. Lupus also is known for the butterfly rash on the face. It also deforms the joints and causes swelling and pain in the joints. Usually, people who are positive with lupus is also positive for rheumatoid arthritis. When a person has lupus or rheumatoid arthritis, the immune system has a problem telling the differences between antigens, normal cells, and tissues in the body. The immune system gets confused and produces antibodies that attack healthy cells, organs, and tissues because it thinks that it is foreign contaminants. These special antibodies, known as autoantibodies, bond with the cells and tissues they are attacking, forming immune complex molecules. As the autoantibodies continue to attack the healthy tissues of the body, immune complex molecules build up at the attack sites, causing pain, inflammation, and damage throughout the body. Systemic lupus erythematosus, SLE, is a chronic inflammatory rheumatic disease that is characterized by autoantibody production and multiple organ system involvement, including a high prevalence of polyarthritis. Fun, Studinsky, and Ward, 1995, Bruce, Fielder, Gladman, Ibanez, and Urowitz, 2005. Poverty negatively impacts the disease for minority patients. The SLE patients often have high chances of psychological problems, such as anxiety, depression, and mood disorders. It decreases the health-related quality of life. This disease is more pronounced in African Americans and Hispanic Americans because they have been exposed to a set of risk factors. This creates a pattern of cumulative disadvantage over their lifespan. Race and poverty affects the autoimmune disease and how it can be handled. African and Hispanic Americans are more likely to get the disease. Does the person in poverty have a way to afford a doctor and the medicine? This also causes stress and psychological issues. The differences are by sex, race or ethnicity, education or income, disability, geographic location, or sexual orientation. When a person has lupus or rheumatoid arthritis, the immune system has a problem telling the differences between antigens, normal cells, and tissues in the body. The immune system gets confused and produces antibodies that attack healthy cells, organs, and tissues because it thinks that it is foreign contaminants. These special antibodies, known as autoantibodies, bond with the cells and tissues they are attacking, forming immune complex molecules. As the autoantibodies continue to attack the healthy tissues of the body, immune complex molecules build up at the attack sites, causing pain, inflammation, and damage throughout the body. Systemic lupus erythematosus, SLE, is a chronic inflammatory rheumatic disease that is characterized by autoantibody production and multiple organ system involvement, including a high prevalence of polyarthritis. Fun, Studinsky, and Ward, 1995, Bruce, Fielder, Gladman, Ibanez, and Urowitz, 2005. Poverty negatively impacts the disease for minority patients. The SLE patients often have high chances of psychological problems, such as anxiety, depression, and mood disorders. It decreases the health-related quality of life. This disease is more pronounced in African Americans and Hispanic Americans because they have been exposed to a set of risk factors. This creates a pattern of cumulative disadvantage over their lifespan. Race and poverty affects the autoimmune disease and how it can be handled. African and Hispanic Americans are more likely to get the disease. Does the person in poverty have a way to afford a doctor and the medicine? This also causes stress and psychological issues. Healthy People 2010, a governmental initiative to improve the nation's health, implicitly defines health disparities within the second of its two goals, to eliminate health disparities among segments of the population, including differences that occur by sex, race or ethnicity, education or income, disability, geographic location, or sexual orientation. The definition according to Healthy People 2010 is broadly inclusive, not restricting disparities, differences, to those occurring between groups defined by single criterion. The National Institutes of Health, NIH, Escalante, 2007. The National Institutes of Health and the Autoimmunity Center of Excellence are behind and funding this drug invention and trials. This is a primary strategy because it is a direct way of helping the diseases. It is a new being developed and is a JBT101. This is known as isonitrulemic acid, which is a cannabinoid derivative. The doctors are working with a synthetic pharmaceutical for analgesic and anti-inflammatory capabilities. This is a direct way to help the symptoms and inflammation of lupus and rheumatoid arthritis. Patent holder Corbus Pharmaceuticals is branded the drug as Resunab, while they are doing clinical paces. It may even have helped to keep lupus and RA in remission. This is a secondary and tertiary strategy because it is for self-help education and an actual exercise to improve the functioning of the joints. Other self-management education and education, physical activity interventions demonstrate some positive, but require more extensive research to evaluate efficacy, effectiveness, and cost-effectiveness before widespread dissemination. Bautov, Brady, Callahan, Helmick, and Kruger, 2003. There are many different types and of people in the area of biology, doctors, physical therapists, and physical trainers, working to find the limits and safety for the body of a person who has arthritis. The public health organizations involved are Centers for Disease Control and Prevention, U.S. Surgeon General, Arthritis Foundation, Healthy People 2010/Healthy People 2020, Midline, Community Health, Interventions Data, CHID, National Institutes of Health and the Autoimmunity Center of Excellence. Now to list continued starts with Arthritis Care and Research, ARC, Pediatric Rheumatology International Trials Organization, Prento, Environmental Health Perspectives, EHP, Health Promotion Practice, HPP, Health Affairs, HA, Health Education Research, HEA, and American Medical Association, AMA. As we can see, there are many organizations helping to fight against lupus and rheumatoid arthritis. In subdisciplines, we have doctors to help diagnose and treat the disease, physical therapists to help keep the joints moving, physical trainers that know the body's limits and can help in the research of the disease. We also have biology researchers looking into the joints, the progression of the disease, and to break down the immune system to study how it is fighting the good tissues and cells. Of course, pharmaceuticals plays an important role because they have found medicines to help with the symptoms, pain, and can slow down the pace of the progression. Finally, you think, why a psychology? Well, being in pain, having a hard time doing the simplest tasks, or being immobile causes great anxiety and depression. Not only is the disease frustrating, but it causes people to miss work or even not be able to work. This leads to financial problems and other problems. It all leads to worry. The services provided are many because this disease is such a mystery to this day. The best they can do is educate the doctors and the patients on the diseases to help guide them in a good direction of being able to help themselves. Free arthritis exercise classes, Aquatics, is a great help to many people. Although Aquatics is really the only exercise offered for free, it can hurt some patients. With the autoimmune disease, it is trial and error for the patient. They have to try medicines and different exercises to find the right method for them. There is little information on the efficacy of the treatment in lupus and rheumatoid arthritis. As we saw, there are many researchers, organizations, pharmaceutical companies working to find a way to help to slow the progression, symptoms, and even the deformities of the disease. The medical researchers say that the disease is not curable. They do want to work on, not only treating the symptoms, but get as close to stopping the disease as possible. The methotrexate is a really big drug in slowing the progression process down. The main aim of the chronic care management, CCM, is to transform daily care for patients with chronic illnesses from acute, ambulatory treatments to more proactive approaches, with increased attention to primary care and delivery of care. Also by educating doctors and patients about the diseases. They also include self-help guides and special diets. Lastly, they provide free aquatic classes for people with arthritis. Ethical questions. Would you ever undertreat a patient's pain because of the concern of addiction or repercussions? Would you ever hide some of the medication effects, such as it may cause cancer, methotrexate? Is it acceptable to do trials on humans before animals to see some of the side effects? What should a patient on a medication that lowers their immune system do if there is sickness, flu virus or cold bacteria, is going around in extreme conditions? Should they stop their medication while the sick season is around?